Some of the most common things that I treat are shoulder injuries, and there's a lot of different problems that can go on with the shoulder, and I have special training in shoulder injuries through my fellowship, my sports medicine fellowship. One of the most common things that I see with the shoulder is a rotator cuff injury. Oftentimes there's either a hole in the rotator cuff or the rotator cuff is actually torn off the bone. Most of the times it's usually torn off the bone. Most of the patients that I see who have shoulder or rotator cuff problems, I would roughly say about 80 to 90% of those people don't end up needing surgery. Most of them we can get better with things like physical therapy. Occasionally we'll do cortisone injections, and if they don't do well with those, then oftentimes it may come down to needing surgery. And the nice thing about shoulder surgery nowadays is that we can perform it in a very minimally invasive fashion. What's most exciting is, even though I've performed thousands of shoulder arthroscopies and repairs over the last 19 years, now we have some newer and more innovative techniques to help improve the results from these rotator cuff repairs and these surgical procedures. One of them is a material called the Restore patch, and it's a biologic, meaning it's a material that allows your body to help heal itself better. With the patch, we're able to allow the body to not only repair the tendon back to the bone, but now allow the quality of the tissue to improve by thickening up the tendon, hopefully thereby resulting in less re-tears down the road.
I ended up falling at work, and I landed flat on my back. Threw my head back, and my shoulder was just messed up. I couldn't reach into the microwave. I couldn't reach into cupboards. I could only send so far. So I came and had it checked out. Dr. Pietropaoli was highly recommended from people at work. He's local, convenient, pleasant. When I got injured at work, I said, I'm going there too. He saw a tear through the MRI, and it wasn't getting better. And he thinks he saw some calcium buildup too. So he would go in and fix the tear, and then he would clean up whatever he saw in there that would make it feel better. He did 3 little holes in my shoulder, and he went in arthroscopically and cleaned it up and fixed the tear, and I was a little sore after, but you get right into physical therapy the next day, and I think that's the best thing that they can do. They take the bandages off, they see what's going on, they make sure there's no infection, and in time, it got better. I knew it would get better with surgery.